بسم الله الرحمن الرحيم والصلاة والسلام على أشرف الأنبياء والمرسلين سيدنا محمد صلى الله عليه وسلم. I am Dr. Ghadah AlAgla and consultant endodontist. I am glad today that I'm going to meet with you in this live session, and I would like to welcome you all in today's session at these blessed days of Ramadan, and wish that everyone is safe and enjoying staying home with family and loved ones. And I would like to deeply thank Al Fursan International School to give the opportunity to parents, guardians, and teachers from inside the school as well as outside the school, and make this lecture public to everyone, so everyone can get the maximum knowledge while staying at home. I hope that everyone is enjoying the lecture of tonight, and let's get started. We will talk today about Save the Tooth, a guideline for parents, teachers, and caregivers. Well, everyone has a kids, and we all wish that our kids be safe and active and healthy. And we know that active kids are always healthy kids. Active play helps kids with coordination, balance, motor skills, and using their energy, which in turn helps to promote better sleeping habits. Playgrounds and outdoor plays equipment over fresh air, and the kids can make friends and have fun and exercise, but it is important to make sure that faulty equipment, improper surfaces, and unsafe behavior do not ruin their fun. In this picture, I am sure that most of us, if not all, have seen children with broken front teeth or discolored front teeth, as we can see in the left side, either dark color, black, brown, or even yellow. And the question comes to our minds, why this tooth look like that? Today, I'll be answering these questions and give simplified guidelines in how to deal with these circumstances and what to do. Unfortunately, each year, more than 200,000 kids are treated in hospital ERs for playground-related injuries. Many of these accidents can be prevented with careful supervision. You can make the playground entertaining and safe for your kid by checking equipment for possible hazards and following some simple safety guidelines. And teaching kids how to play safely is important. If they know the rules of the playground, they are less likely to get hurt. So here, supervision is a key. Also, teaching the kid how to play safely and knowing the rules and the guidelines for playing with others is very important. So most of these accidents are due to dental trauma. And now we have to know, and I will make you familiarize what dental trauma is. Dental trauma is an injury to the teeth, gums, lips, and jaw bones. Most common dental traumas are broken front teeth or displaced tooth. Displaced tooth, we can call it in another terminology as a knocked out tooth. I suggest that everybody prepare the mobile phones for screenshots if you like what you see, and you think that it is beneficial for the future use or sharing the knowledge with others. Please take a screenshot and share it freely. First, I would like to talk about the function of the teeth. Why the teeth are very important to us. We are using our teeth for cutting and chewing food, for pronunciation, and the appearance. And there was a review of the current evidence base shows that children who have suffered a traumatic injury to the dentition report worse oral health related quality of life. They are also more likely to suffer decreased self-esteem due to their appearance, especially when these issues are not effectively managed or neglected. I have to tell a story in this manner. I remember, like, if you see that yellow tooth, I remember a patient attended to my clinic. When she came to my clinic, she was 18 years old, and her main complaint was, I need to treat that front black tooth. She was a twin of another identical girl, and she was suffering since the age of 9 when she had her front tooth, and the colors start to turn black gradually. She said they are differentiating between me and my twin by calling me the twin with the black tooth. So when she came to my clinic, she said, please, doctor, I want to get rid of that black tooth, treat it as much as you can. Though the problem was very old, it was 9 years old, and the impact was really severe on her. There was a psychological trauma, yet the treatment was very simple and very fast. We treated that. I remember that I treated that tooth in less than 24 hours. She went back home with a completely white tooth, and nobody called her a twin with a black tooth anymore. By statistics, a common occurrence with an estimated of 80% of traumatic dental injuries occurring before the age of 20. And the 7 to 12 years age group is considered the most prone to any form of dental trauma. The global phenomenon of dental trauma is estimated to affect 50 to 60% of the world population, including primary and permanent teeth, and we will come on to explain exactly what are the permanent and what are the primary teeth in the upcoming slides. Boys are always more than girls, of course, and protruded inclined teeth to the outside, as we see here in the picture, they are more prone to injuries than normally aligned teeth. Also, upper front teeth are always more prone to these types of injuries. The causes of the injuries, they have categorized these injuries according to the age. Toddlers, that the age from 1 to 3 years of age, are more likely to injure their teeth by falling down, while older children are more likely to suffer dental trauma from sports injuries. Teenagers, obviously, often present with dental trauma as a result of fights. Now, in order to understand what are the upcoming slides and what we are talking about, we have to know exactly the anatomy of the teeth, how many sets of teeth the human being have. We have the human being have 2 sets of teeth in their life cycle. The first set of teeth are the primary teeth. They appear as early as the age of 4 months. The average are 6 months, and there are 20 teeth in number. They shed off at the age of 6, around 6, sometimes 9. It depends on the chronological development of the kid and the gender. The other set are the permanent teeth. They are 32 in number, and they appear after shedding off the primary teeth, and these teeth will stay for the rest of their life. They never change, and they never shed off unless there is an accident. Knowing also the anatomy, we have to know that the teeth mainly has 2 parts: the crown, that part that appear in the oral cavity and in the mouth, what we see, and the root that holds the tooth in place in the jawbone, and it's not visible to us. And the layers of the tooth, the most outer layer, that the white layer that we all see, is the enamel. Under the enamel is the dentin, that you cannot see it, and the pulp of the teeth that has all the vital tissues to keep our teeth vital. It has blood vessels and nerves. And here, where the tooth, when it turns black, means that the pulp of the tooth is dead or dying. So that's why we encourage patients, we encourage the parents, if you see these teeth turning black, you have to immediately take your child to an endodontist. Endodontists are the doctors that meant to treat the root canal treatment. They meant to treat the pulp. Also, in order to guide you, all of you, how to manage these traumatic injuries, you have to know also the anatomy of the front teeth, especially since they are the more prone teeth to these type of injuries. We have the front part of the tooth that we all see, that toward the lips of the mouth is always convex. The front side is convex. You have to know these in order to manage the cases if you have it. The convex part of the tooth is the front of the tooth, and the concave part of the tooth is that surface that toward the inside of your mouth. And of course, as I mentioned before, that's the root that you cannot see. It's always inside the bone, and this is the crown. Now, when the tooth is out of the jaw, the part that is called the root is always yellowish than the crown part. The crown is always more white than the root. Now, here's the core of the lecture. That what are you going to do if this happened to a child while you are in charge? If the teacher is in charge and the kids are in the playing ground, one of them fell off and an accident happened, what shall you do? First, you have to be calm. Teachers or parents, also the parents sometimes, especially now these days where we're in the quarantine, they're playing a lot and the medical services is not very available like before. Now the question, if that happened, what are you going to do? First, you have to be calm and strong and think twice and act quickly, because time is a factor in these injuries. First of all, as I mentioned, traumatic dental injuries are not life-threatening injuries. Means the life is not critical here, unless you have noticed something in the child abnormal. So it is important for the parent or the guardian teacher to assess the central nervous system of the child in front of them. How do you assess the central nervous system? You have to be cautious if there is any loss of consciousness, if the child has any blurred vision or slurred speech, or the child has vomited, or he has any irritable breathing. Now, if any of these happen to the child while you are in charge, means there is a trauma to the central nervous system, either a broken bone in the skull, or there is an internal hemorrhage. Now, when you reach that conclusion, then it is a life-threatening. Teeth in these stages are not important as the life of the child. You have to take immediately the child to the emergency room for further investigations and to check the vital signs of the child. If none of these happen to the child, then it's only a minor trauma, either knocked out tooth or broken or displaced tooth, then you can be in charge until you take the patient to the dental office. The following guidelines were recruited from the International Association of Dental Traumatology. Since the most common incidences are the broken teeth and the knocked out teeth, we will focus on these two incidences and how to manage these in the scene of the injury. I will focus on the knocked out tooth, yet it is very rare to happen, but when it happened, it is a dystrophic event. If you don't act quickly and correctly, the child can lose the tooth forever. So first, when the child fell off, there will be a lot of bleeding. He will be crying, and I think it will be a mess situation. You have to take over, calm the patient, assure him, the child, assure him, and try to find the knocked out tooth. You will look at the mouth and you will do a quick examination. You will check if the tooth is knocked out, is out of the socket, out of his mouth, or it's broken. If it's knocked out, the complete knocked out tooth, you have to find that tooth and hold the tooth by the crown, not by the root. As I mentioned before, the crown is the part of the tooth that is appeared in the oral cavity in the mouth. And the conical part of the tooth, that is the root, which is inside the jawbone, you should not touch that part in any mean, because there are special cells covering that root. If you touch it, these cells will be damaged. then the recovery period will be very hard. It's not impossible, but it will be very hard. So please hold, you have to know from where to hold the crown, the tooth, hold it always from the crown, not from the root. Now, if you find that tooth is dirty or contaminated with any mane, please rinse with cold water and put it back in place. This can be done by either the child. If the child, I mean, if he's teenager, 16, 17, or 18 years of age, he can do it by himself. If not, then you have to do it by yourself. I will show you now exactly how to put it back. Replant it immediately. Replant means return it back to its place if it's possible. When you return it back to its place, please hold it in place for 5 minutes to stabilize it. If you cannot hold it by yourself, ask the child to bite on a piece of tissue, then take the child immediately, seek dental treatment. You have to take him to the dental clinic immediately to continue the treatment. Now, if you cannot put it back in place because of incorporation, for example, from the child, you can put it in a cup of milk or saline. If the cup of milk or saline is not available, then place the tooth in the child mouth itself, in between the cheeks and the gums, and immediately seek specialized dental treatment. While you are doing all that, you have to make a phone call, doctor, I'm coming. Always dentist and endodontist have a slot in their schedule for emergency cases, and they will accept all emergency cases. This is the way where you hold, and we can see here, this is the convex surface that I told you before. It is toward outside of the mouth, and this is the concave surface that is toward inside of the mouth. This is how do you hold it grasp it with 2 fingers and push it inside. How do you know that you push it inside properly? You will see that the tooth is in alignment or in the same level of the neighboring teeth. If you cannot push it the whole way down, then you can ask the child to bite on. It's not a big deal if you cannot push it the whole way down. Try your best to do so. But if you cannot, then ask the child to bite on a piece of tissue and hold it in there until you reach the dental clinic. Now, all that scenario, from the trauma to finding the tooth to return it back to its place, should not take more than 30 minutes. If you do so in 30 minutes, then the survival rate for these cases are very, very high. Means that the success of what you did is very, very high. The tooth will stay in place and everything will return normal after a couple of days. Now, what if the tooth is only broken, chipped tooth only, but it's still in place? Find the piece of the tooth, then take it to the dentist with you, seek the dental help as fast as you can, because the dentist will glue that piece to your tooth and everything will return normal. What about displaced tooth, but not chipped? Most of us can see this picture that my child fell off and hit the table and the tooth moved inside or outside or inward or outward. If it's happening like that, then you cannot do anything in these circumstances, but seek the dental emergency immediately. Let an endodontist or a dentist see this child because he will return it back in place within 24 hours. After 24 hours, the dentist cannot do anything because the tooth will be locked in its place, a new place, and it's very hard to return it back immediately unless he will want to do ortho treatment, that is braces, and they will push the tooth back again to its place. That will take too long time. But if you can reach the dental clinic within 24 hours, that will be amazing because he will return it back immediately, and then we will splint. Like everything in the body, when it breaks, we do splinting. We do splinting also for the teeth to stabilize it, and we will to return everything back to normal. Soft tissues, teeth, everything will return to its normal place after splinting. If you have questions, please write it down on the question and answer on the right side. I'll do my best to answer these questions at the end of the lecture. Now, what if there is a skin lacerations and bleeding? It's very simple. We do it every day. Apply cold packs. If you're in the home or in an accessible place that you have ice, please put it in a plastic bag, apply it on the lacerated area, or if the ice is not available, then compression with tissue will stop the bleeding. And take immediately the child to the dental clinic, because sometimes the cuts are very deep and it needs stitches instead of only compression. We have to emphasize, and we always emphasize, all the dentists do so, oral hygiene is necessary in the healing period, of course. And be aware not to neglect any complaint from the child. Neglection can lead to serious complications, not only psychological complication, by systemic, it can lead to life-threatening situations. I have to mention here one of my cases. That's a neglection case. That girl, she was 9 years old. She fell off. I think there was a fight in the house between her and her brother, and she fell off and broke her front tooth. She complained to the parents, but they just ignored the complaint. They thought it's a simple thing. After a month, she woke up in the morning with fever, severe pain, and facial swelling in the anterior side of her face. As you can see here, the right side of her face is completely different than the left side. There was a huge swelling here. You can see from the nostril of the nose. Well, upon examination, we have found that a front tooth has broken, and which she was suffering for a month from pain, because the pulp, as we mentioned, the pulp where the blood vessels and nerves are, the pulp was exposed. So you can imagine that the pulp and the nerves are exposed, how much pain she was suffering from. She came to my clinic. At that time, we managed the tooth. We did a root canal treatment. Then we restored the tooth again with filling material, and everything went normal. If the parents bring her to the dental clinic immediately at the time of the trauma, they will save all that time and all that pain and fever and suffering of their child. Another case of Abdulaziz. Abdulaziz is a smart boy. He's 13 years old in 2015. He came to my clinic. He was coming back from school using the school bus. When he was about like 2 or 3 minutes away from the house, all of a sudden the driver of the school bus brakes and he hit the front chair. A laceration happened and his front tooth was chipped. Abdulaziz was very smart. He went from the bus, asked the mom to take him immediately to the dental clinic, and they came within half an hour from that trauma. Abdulaziz brought the chipped piece with him, and you can see this is the chipped piece, and that's the trauma. He has little blood here in the gums, which is normal. Of course, at that time, we did all the investigations, checking, clinical examination. We took x-rays to be sure that the bone is not broken, no broken bones. We checked his central nervous system. Everything was okay. At the same visit, on March 17, I glued that piece of tooth back to his original tooth, and everything went normal. He went back after less than 60 minutes back to his house with an excellent appearance. His tooth was back. Abdulaziz is still until now. After 5 years, he's contacting me. He is very happy. Still, he has that pretty smile and pretty teeth. And the chipped piece, the glued chipped piece in place until now. Another case, that's an 18 years old guy. I can't say a child, a guy. He has a car accident and he went to a dentist immediately, but due to improper management, he was suffering from discolored tooth and improper filling material. Everything was done. We bleached the tooth and restored the tooth again to its normal shape, and he was very happy. He went back home with white tooth and fully formed tooth too. Here, a 19 years old also lady She's a lady. She got a car accident and she went immediately to a clinic and they did only a splinting for her front teeth. Though she was smart and she found that piece and she brought it with her, but the dentist did not glue it back and she went to home upset, very upset. She was very upset. After 4 days, she came to my clinic asking, please fix my front tooth. I cannot tolerate seeing myself in the mirror as ugly as having these teeth. Please fix my teeth. So I removed everything. The surprise was after taking x-rays, we found that the bone was broken. All her bone from front side here was broken, but it's not displaced. Means the bone was broken, but it's still in place, did not move. Teeth did not move, and the jawbone is not moving. So in these circumstances, we have to do splinting. I removed the old splinting. I glued the chipped piece, and I placed a new splinting for her front teeth. After 4 months, the surprise. Patient came after 4 months for follow-up, and she was very happy with very pretty smile and very pretty teeth. Everything looks normal because we just glued the chipped piece. It's all about managing the time. So this is before and here is after. So here is the summary of how to save the tooth. Keep calm, find the tooth. If it's knocked out, in these cases, if it's not knocked out, find the tooth, wash it if it's dirty or contaminated, return it back, and seek immediately dental clinic because the dentist need to splint the teeth for 2 weeks or 3 weeks to keep everything in place. I will try to send this poster via email to all the parents and teachers, so you can keep it, you can print it out and keep it in your offices or in your classroom. Now, what we talked about previously are all about permanent teeth, not primary teeth. Permanent teeth are the adult teeth. How to manage when they are knocked out or when they are chipped. Now, for the primary teeth, the kids' teeth, how can we manage these cases if it happened to the clinic? I mean, in the public area, either school or the house. Well, my child or student chipped his front tooth. What can I do? If it's only chipping, the management is completely different than the management of teeth for adults or permanent teeth. It's completely different. If a primary tooth chipped, then don't try to find that chipped piece because the dentist will never glue it back. Usually, primary teeth are tiny teeth. And when they chip, the piece is also tiny. And if the dentist try to glue it back, they will never retain because the size is small. So usually either if the chipping is very small, we just smoothen the sharp edges of the tooth and we keep the tooth there doing nothing. If the chipped piece is big a little bit, we're placing only a filling material. And they look nice, the same tooth color, and the child will feel great after that. So no need plan. You don't need to find that chipped piece if it's broken in a primary tooth. What if the primary tooth knocked out? If the primary tooth knocked out, you don't need and you shouldn't replant it again. Don't bother yourself searching for that tooth because you don't need to replant it again because replanting a primary tooth will affect the underneath permanent tooth. Sometimes you can say some people with a brown spots on their permanent teeth or white spots or the outer surface, the enamel of the tooth doesn't look normal. That's because the patient has a trauma in their primary teeth when they were young. So try to keep your child safe, the primary teeth safe, not only for the primary teeth itself, also for the future permanent teeth. And when they're knocked out, don't try to find it and don't try to return it back again. If you are in doubt, you don't know that tooth is a primary tooth or permanent tooth, please take the tooth with you and immediately reach a dental clinic within 30 minutes. So the dentist will take over at this circumstances. He will check if the tooth is permanent or not. If it's permanent, he will take care of it and he will return it back. If it's not, then he will find solutions and he will know what to do after that. So we always say prevention is better than cure. How to prevent these traumas? First, don't use baby walkers. These baby walkers on the right side are terrible baby walkers because there is no safety at all, and they can trip on these and fall down and hit their teeth. The baby walkers on the left side, they are better if you don't have stairs. If you don't have stairs, you can freely use these and safely. Don't let children use roller skates without protection. We will talk about the protection at the end of this lecture. Teach your children to look after their teeth as well as that of their friends' teeth when playing by not knocking their teeth with heavy objects. And watch out for possible obstructions that they can trip themselves up on. Don't push when playing. They have to know these important rules. Stay seated on the swing and do not jump off when the swing is in motion. Use stairs when setting out of the swimming pool. If the child participates in sports such as football, hockey, karate, riding on a bike, or winter sport like skiing, then you have to ask your children to put a helmet or mouth protectors. Now, the mouth protectors, we have two kinds of mouth protectors. Ready-made mouth protectors that you can get it from the pharmacies over the counter, that you put it in boiling water, then you seat it in the mouth and it will take the shape of your teeth, or the mouth protectors or mouth guards that can be fabricated or obtained from the dental clinic. It is custom made, and I highly advise people to go to the dental clinic if you have a child who is active and participating in lots of sports. Fabricating these protectors in dental clinic is very advisable, and they are not expensive too. For severely inclined teeth, orthodontic treatment, that is the braces, are the treatment of choice to align your child teeth and to reduce the chances for injuries for these teeth. Thank you very much for listening to me today. This is my email. If you have any questions, please do not hesitate to send any questions to my email. And this is my coordinator mobile number. If anyone has emergency, please also do not hesitate to contact her to come immediately and manage these cases. I will try to answer the questions now. Oh, I think there's. I'll try to answer some questions. I had a lot of questions. I will try to answer these. Here's a question saying, what is the ideal age of correction of protruded upper front teeth? It depends on the chronological development of your child. In general, as soon as all the primary teeth shed off, it could be a proper time, but the best answer, you will get it from an orthodontist. You have to visit the orthodontist and check his teeth or her teeth and let you know exactly the proper time. What is the best time to start braces? Again, this is the same question. Oh, this question is not related to our subject, but since we still have time, I can answer this question. She is asking, my son is 7 years old. His front milk tooth is still not out, but getting loose, though the new teeth is coming from the back. Okay, and is moving in the inside direction. Since the permanent tooth is coming out, then it is the proper time to take off the milk tooth as soon as possible. So they will be aligned and they will be all in the same alignment. You have to take them all. Thank you very much for listening. I hope you enjoyed the lecture of today as much as I did. And if you have any questions, please Send it to my email. And feel free to ask me or send me questions at any time. Thank you very much, and I wish you a very good evening.